As states gradually reopen across the country, contact tracing for COVID-19 is more important than ever to contain infections and spot hotspots when they come up. Up to 300,000 contact tracers could be needed nationwide, according to experts, but there is no unified federal plan to hire or train them. Joining us now, a congressman with a plan to do just that, Democratic Congressman and Assistant Majority Whip Jimmy Panetta from California. Congressman, thanks very much. It's great to see you again. I've heard other people, like Senator Coons, talking about bringing volunteers in from various service corps. Tell me how your proposal works with that, or it, could be part of a modified congressional approach.
Yeah, thank you, Andrea. I appreciate this opportunity. What it comes down to is we all feel the urge to open up, but we need confidence allowing people to go out to these businesses, allowing people to understand who is sick and who is not sick. And obviously testing and contact tracing does that. My bill, along with Congress members Underwood and Crow and Senators Gillibrand and Bennett, basically allows for using the existing infrastructure that's already in place. What you have to realize is this type of contact tracing, that's already been done when it comes to TB, when it comes to HIV, when it comes to measles, when it comes to STDs. So use that existing force with the existing knowledge of the people in those communities to make sure that they get out there and to make sure that they are able to contact people who have come into exposure to the person who was tested positive. It's sort of a sharper edge tool, as I like to say. For too long, we've been using a blunt edge tool of sheltering in place. This is a sharper edge tool to basically allow us to move forward, allow us to open up, but be it responsibly and be it carefully as we go forward. It's something that's definitely been used before. Let's do it again. If we don't have a vaccine, let's make sure we have testing. Let's make sure we have this contact tracing to stop the chain of infection that we're seeing can hinder us in fighting this disease.
Now, is this army of tracers, the existing infrastructure that could be expanded, is this part of the CDC, part of the Public Health Service?
It's an excellent question. We want to make sure in our bill, we want to make sure that we fund the existing workforce that's already there, people who are familiar with the communities. Rather than having an outside influence come in, we want to make sure that it's sort of the ground up. People who already have the wherewithal, have the cultural knowledge and the cultural sensitivities of the populations they are contacting. Now, it can be reinforced with people from, be it FEMA, be it from CDC, be it a national workforce, which I think is smart, especially considering the numbers that we're asking for, that we're calling for, that you're seeing governors call for. My governor, Gavin Newsom, is asking for a health force of close to 20,000 up north in Santa Clara County here on the Central Coast. They want 1,000. Here in Monterey County, we want about 68. So it's going to depend on the region, on the town, how many is needed. Hopefully we can we want to use the existing infrastructure, but it will be reinforced by a workforce. And that's part of our bill, to have a resilience force, a force that's ready, willing, capable to go in, not just for contact tracing, but for national emergencies as well. And so it's that type of reinforcements that will be needed, obviously, not just here on the Central Coast of California, but across our country.
Now, it seems to me very timely, given that the Fed chair was just saying on 60 Minutes that unemployment could hit 25%. We're talking beyond Depression-era levels, and this is the kind of thing that FDR did.
Yeah, no, that's correct. Look, it's a workforce that we can put in place that will train and get people back in there. I think, what Powell said is he used the word people can get atrophied. And that's what we don't want. And that's why we want to make sure that we provide this opportunity for people who are put out of work to basically get back into work. I mean, as we're seeing with pandemics and as we're seeing with these shelter-in-place orders, we're asking people to stand down. We're asking people to stay at home. That it's okay to watch Netflix all day. They're doing their part. But that's sort of averse to what we stand for in our democracy. We're used to standing up and stepping into it. This type of workforce will allow people to do that, especially those who are unemployed. And that's one of the priorities, making sure we focus on people who have lost their jobs, focus on veterans, those in the healthcare force as well.
Congressman Jimmy Panetta, who represents one of the most beautiful districts in the entire country, as I can attest to, fabulous Monterey and Carmel area. Thank you very much. Good to see you.